90 and the recording's going on. So, so I think we'll make a start if that's all right, guys.
Of course.
So an absolutely massive warm, because it's sunny in so many places, welcome to the webinar this morning on behalf of HPMA. My name's Tracy Hill, and I, together with Joe, who is also on this call, Joe Owens, we both work for HPMA, and absolutely delighted that we've got Caris, Sarah and Nick with us again this morning to take us through an hour on how unwritten rules are shaping our culture. I've just mentioned that the recording's gone on, so hopefully that's okay with you all, because that means that this will now be available, or later be available, on our website for further reference. So all else I want to say really is just enjoy. If you've ever been on a session with our colleagues from Delve before, I think it's a very easy thing to ask of you to enjoy, because we always do enjoy ourselves when we're with the girls from Delve. So great, over to both of you, well, all three of you actually this morning. And for everybody else, like I said, enjoy and please contribute. And we'll look forward to hearing your evaluation as well at the end. All right, thanks ever so much.
Thanks, Tracy. Well, welcome everybody. As I said, so lovely to see you all on this second of the series. As Tracy said, all today is about is thinking around. So last time we looked at the type of culture that we want and how do we visualize that. And this time we're going to start to think about actually what's governing that. How do unwritten rules impact us actually shaping that culture? But first, I'd just like to tell you a little bit about Delve. If you're new to Delve, just to give you an idea of who we are, where we've come from, and this is our vision on the screen. You can see that we really believe, and we're very fiercely passionate about this, that we want to help organisations become places where people thrive. Let's face it, it benefits us as individuals, it benefits organisations, ultimately benefits wider society, because we're a much happier nation if we're engaged and empowered at work. So this drives us in everything we do. And as an organisation, we've grown a lot since 2015. You can see the image on the slide there is our actual shared office, where we are in Ashton-under-Lyne, in Greater Manchester, and it's a converted swimming pool from the 1870s. So that arc that you can see sits over where the water used to be. Really lovely place. Original architecture in there as well. So it's quite inspiring to be able to work in a place with so much history. And it beats some of the places that we used to work in when we were both in the NHS. Sarah and I, our background is in the NHS, and sometimes we didn't have windows, which is really sad, isn't it? But we now get to work here. Just to tell you a little bit about how we achieve that vision, and how we help organisations. We focus on 4 things. So we have an inclusive talent tool, which helps people to have different conversations around talent, something quite often replacing the archaic appraisal process that we're all used to. We also upskill people professionals in transformational OD practices, and we have leadership and other talent development programs as well. And just to give you a flavour, if you're brand new to us and you've not been on one of our webinars or one of our sessions before, you can see 3 of our team here. We've got Sue there, who's not with us today, and Sarah and I in the bottle. But we've also been joined by Caris today, who's supporting us. So you've got a few of us here today. And this is just really what our clients tell us about what they love about Delve. And hopefully you will see some of this come into fruition after this webinar. We very much believe in giving you takeaway things, practical things that you can actually do from even a short session like this. So just a quick reminder, the 3 webinars that we've been the 3 webinars that are part of this series. Last time we were thinking about how we assess the gap between the culture we have and the culture we want. And today is all about those unwritten rules and thinking about how data can be more actionable rather than, I mean, let's face it, in the NHS, we are absolutely drowned by data, and it's lots of intelligence but very little insight sometimes, and that's what we're going to focus on today. The next session on the 30th will be all about addressing that gap, one conversation at a time. So it'll be more about what do we focus on with leaders, what do we focus on with the board. So welcome to the second part of that series. So just thinking about, when you think of culture and data, what springs to mind? So at the last session, we talked about visualizing the culture you want as a really important first step. So what sort of data will tell you more about your culture? What's going on there? Please do just pop in chat. What do you find the most useful thing to look at that tells you what your culture, where your culture is right now?
Yeah, we've got NHS staff survey. That's quite key at the moment, isn't it? With the results coming out, so that's definitely something in there it's important.
Yeah.
I Matter survey. Pulse checks, high turnover, low engagement, that kind of thing, absence levels, complaints, anecdotal conversations. Absolutely. We'll talk a little bit around the different types of data as well, and you know, where we pay our attention to.
Absolutely. So we've got lots in there. Yeah, gives you a really good indication, doesn't it, of I mean, I don't know if anyone else feels like this, but certainly the staff survey alone, when we were in the NHS, it just made me just stick my head on the steering wheel and need a very large glass of wine, because it was just so much data in there. It can be absolutely overwhelming, but if given more time, it allows us to really understand what's going on. So when we think about all the data we have within our organisations, and we see stacks of data, we can't get enough of it. You know, reports are 1,000,001 pages long. There's another report every day, another paper to read from the government.
As the first part of that, I think that's in the diary.
Just make sure everybody's on mute. Go. So you only have to, I say, you only have to look at the NHS staff survey to think, oh my goodness, where do I start? And for many of us, this is completely overwhelming. We can't possibly digest this information. And we know that as people professionals, quite often, it's down to us to simplify it for everybody else. And one of the tasks I used to be as head of OD, I used to think, well, I need to get managers using this data more effectively so that people can take charge of their own areas and really understand what's going on. So when we think about data and intelligence is data that's relevant to the topic at hand. Now, it might be relevant, but that doesn't mean it's usable, because we're often faced with stacks of it. So it's ironically often a part of workplace culture. We can sometimes feel safety in the stacks of information. This is intelligence, but it doesn't actually lead to change. And that is the problem. Intelligence is lots of information. Insight is what we can do with it. And the process in itself can have challenges. So sometimes we wait for those insights to happen and they don't. And we do have to take people on a little bit of a journey so that they understand it. And like I said before, you know, my ambition was to just make sure every manager picked up a staff survey, a broken down version of that for their own area, and really used it to make a difference to the culture. But let's face it, we don't get many people doing that. So what we'd like to do, I mean, just before we do a quick poll to see where you are, just look at the rest of the world, really. This is from Forbes, and we know that these statistics might be slightly different for NHS, but actually overall, 74% of organisations want to be data-driven. But actually, you know, there's only 29% that actually are data-driven. And data-driven is kind of that being good at connecting analytics to action. So what we'd like to have it just and explore right now, Joe's going to launch a poll for us, and it's just really thinking about, on a scale of 1 to 10, how much would you say you have intelligence versus insight? So lots of data. So 10, if we imagine 10 is absolutely, we are very insightful about the data we have, we're using it, we're actioning it, it's making a difference. 1 being lots of reports, no one's really doing anything with them. So just have a little vote at that. So 1 being lots of intelligence, 10 being lots of insight, that is analytics connected to action. We'll just give you all a chance to vote. Okay. I can't see if that's nearly there, Sarah.
It's 78.
78, okay, brilliant. Just a few more, then we'll share it.
Right, I'll share now for you.
Brilliant, thanks, Joe. Oh, real mix then. That's brilliant. It's good to see that we've got some, well, not many 10s, but actually some 6, 7s and 8s, which suggests that you're nearly there with it. And I imagine time is probably one of the biggest barriers in terms of really understanding and breaking it down into true insights. And if you are down that lower end, hopefully today will just give you a little bit of prompting and a little bit of information that might help you get on track with how you turn intelligence into insight. So fantastic.
Brilliant.
Okay.
We can close that poll now, and let's explore in a little bit more detail when we're talking about insight. What do we actually mean by that, and how does that differ from intelligence? So we start with the data, and that's anything that we collect. So even information that we don't use. I mean, think about how much information you collect. Think of all the things that you shared in the chat already. And that turns into intelligence when we link it to a problem at hand. So intelligence is essentially that useful data. So if we take an example of absence, so employee record data that links to absences is the useful bit, that's our intelligence. And then we move to analytics, which is essentially what is that intelligence actually telling us? So analytics involve collecting, analysing data to identify patterns and trends. So again, coming back to employee absence, that might include things like tracking absenteeism rates over time, identifying which teams might have higher rates of absence, examining reasons why people are calling in sick, looking at how many incidents of sickness it is, whether it's short, long term. And analytics can provide a wealth of information about absence, but doesn't necessarily tell you why it's happening or what we can do about it. Insight, on the other hand, that involves using analytics and other sources of information to gain that really deeper understanding of the causes and the consequences of absence. So that might involve talking to people to understand why they're absent, examining organisational culture to see if there are any factors that might be contributing to absenteeism, looking at the impact of absenteeism on things like performance and productivity. An insight allows you to see the bigger picture and make more informed decisions about how to address absence. And it's the unwritten rules that almost govern the behaviour around absence. If you think about, you can have all the data in the world, but actually there's some unwritten rules that are having that big factor. And it's a great model that you can use to assess where you're at in terms of the cultural challenges that you're facing. And in summary, really, analytics provides that data and metrics around culture, while insight involves using the data to gain that real deep understanding of the causes, the consequences, and developing strategies for reducing it. So analytics helps you define the problem, and insight allows you to really, truly understand what's going on. And it's easy, as we know, to fall into that trap of collecting lots and lots of statistical data, but we can become overly reliant on this. And that's where we almost stop at that analytical stage and become barred from ever reaching the insight level. So this is where we want to take a step back and think of all the data that we've got access to. What is it that we're looking for? What's our ideal culture, and what data might be relevant to that? And Nick's just going to share a bit of a personal example just to bring this to life for us.
Yeah, I mean, NHS obviously is driven by data and driven by government set targets that sometimes you just think, where's this come from, and how has this been translated? So low blood pressure, for example, I've always had low blood pressure, and when I was having a short stay in hospital after my second son, they wouldn't let me out because of this low blood pressure, and I kept saying, well, this is normal for me. If you look beyond what you're seeing right now, the data that you're seeing right now, you'll see that I've always had low blood pressure. It's not a problem. It just runs in the family. This is normal. And they wouldn't let me. It just still kept me in. I was thinking, if we just take one piece of data, we don't see that holistic view. And I know that's a bit of a weird example to bring in, because a lot of us are dealing with workforce data, but you can see how it kind of just goes right the way through the healthcare system.
And another example is C-section rate. So it's a topic that's appeared in the news recently. There are lots of investigations into this, and we might look at the rates of C-section and think they look good. But when we explore why they are the level that they're at, it highlights some significant cultural and working practice concerns. And you'll have seen this come through various reports. But the topic of working practices is an important one because it often bleeds into policy and gives us a real opportunity to see what cues there are in HR and OD, what we're enabling that keeps barriers in the way to behaviour change that we want to see. And we can't take the statistical information at face value because it's not the primary place where our insights come from, really. So having a look at where we get our data from, and obviously if you refer back to that list in the chat, you can start to perhaps categorise different types of data into this model. But you'll find that there's direct data, there's indirect data, it can be qualitative, quantitative, and some of the things that are actually direct are things like observing behaviours, and this can be quite objective, just to almost walk a day in the life of somebody, or go out on a ward, go out on an ambulance, find out what's really going on, observing what's happening, what are some of the dynamics. You might sit in a meeting and observe behaviours. It's really interesting if you're not involved in that meeting, just to sit back, see who's got the most power in the room. Where are the conversations happening? Are the people that aren't getting a word in edgeways? What does that look like? So observing behaviours is a great thing to do. It's time consuming, but it's one way to get some really qualitative data. You've also got some subjective data on that left-hand side. So in that bottom left quadrant, you've got stories and anecdotes, but these are so important. We'll explore a bit more about this at the next session when we're thinking, how do we change culture one conversation at a time? But actually hearing those stories really brings things to life. If people see statistical data, it doesn't really mean anything. But when you see the stories that people are sharing and the anecdotes, actually that brings it to life and really wins hearts and minds over. There was one organisation in the NHS that I used to work for, and we started every committee meeting with a story from either a patient or a staff story that was pertinent to perhaps a particular report on that committee meeting, that just really brought it to life. And it was even more powerful if we could get that patient or that staff member in the room and sharing that story. Don't underestimate the power of some of that qualitative stuff, because we've got a lot in terms of metrics and results, and some of the stuff on the right hand side that you've mentioned. So what are some of the results telling us? What those survey ratings? That's all brilliant, but actually what are some of the stories and the qualitative stuff that's supporting that and backing that up? And if you remember last time, if you were on the last session, we talked about the diffusion of innovation model, and sometimes the quality stuff might be harder to source, especially if you're in a culture with low psychological safety, and we'll explore that shortly in terms of what that means. But the bell curve will be quite tight in terms of people willing to step forward and share some of that qualitative data and what's going on for them. If you think back to the absence policy, if we ask somebody, what's the process been like for you? If you don't feel psychological safe, they're going to go, yeah, fine, and not share some of that knowledge that will be really useful to you if you want to shape the culture. And you might put out a survey and get limited responses, or ask to speak to people but they're not interested in sharing their view. And if you think about, I don't know if anybody goes on TripAdvisor and writes reviews, I do. And I've started consciously trying to write really positive reviews as well as negative ones, because I think people are more likely to complain than they are to share a good news story. So it's getting that real balance with some of the insight that you're getting as well. Just to share, this next slide, if you think about CQC, for example, and some of those quadrants that you're exploring as part of your CQC, overall culture, how teams and individuals thrive, and what psychological safety looks like. Lots of different things, and again, refer back to the list in the chat that you had, but think about some of those. These are all the quantitative measures. So you've got your pulse survey results, turnover, you've got things like internal comms. If you look at that top right, how many people are actually using the whistleblowing policy? So a culture that has a clear whistleblowing policy, for example, reassures people that they're safe to report concerns, but actually how many people are using that, and what does that look like? Things like how many performance conversations are happening, what holidays are taken versus what's actually owed to people. So lots of different things in terms of that quantitative, those quantitative measures. And then if you look at some of the qualitative measures as well, so again, lots of different things. You've got things like 360 feedback, you've got the sort of free text responses in the engagement survey. We talked about exit interviews, and we in the chat we've been talking about stay interviews. So actually they can be quite useful. So I almost think with an exit interview, it's too late by the time you get to that exit interview because they've left or they're leaving. Whereas actually, if you're asking people, what makes you stay here? You know, why do you get out of bed in the morning? What actually, are you happy about working here? What is it that makes you stay can be really useful. And I know we've got a comment in the chat there of almost stay interviews are good indicators of where people might be getting itchy feet and almost preempt someone who's thinking of leaving. So rather than exit interviews, which is too late to do anything about, actually what's going on for that person. So thinking about all those qualitative measures that you can have as well is really, really important.
So thinking, just to give you some real life examples here, if anybody is in Hackney, the London Borough of Hackney, just put a big thumbs up. But the difference between the Hackney and Boston, actually, just to give you, in 2019, the London Borough of Hackney launched a community-based research project called Hackney Voices, which you may or may not be familiar with. But the point of it was to gather insights about the experience and perspectives of people from diverse communities within that borough. And the project was designed to address a lack of representation of marginalised groups in traditional research methods, and to empower local people to shape and inform decision-making processes. So the council recruited and trained 18 community-based researchers from diverse backgrounds to conduct interviews and focus groups with people from their own communities. And the researchers were paid for the time and were provided with ongoing support and development and guidance throughout the project. Then in 2020, the City of Boston in the States launched a community-based research project called Boston Rises, which stands for Resilient, Inclusive and Sustainable Engagement Strategy. And the point of that was to gather insights about the experiences and perspectives of people from diverse communities within the city. So the project was designed to empower people to participate in those decision-making processes. The city recruited and trained 22 community-based researchers from diverse backgrounds and neighbourhoods, and they conducted surveys, interviews, focus groups with people from their own communities. And the researchers were paid for their time, provided ongoing support and guidance throughout the project. So there's actually no difference there. But in both cases, by recruiting and training community-based researchers, that they'd sourced and trained to have conversations with others in their communities, the city was able to gather insight that probably would have been overlooked or ignored through traditional research methods. And to develop more responsive and inclusive policies and services, that was absolutely crucial for them both to do that. So what can we learn from this? Well, as HR professionals, it can be hard to gather the information we need outside of the parameters and the surveys that we send out currently. You only have to think about the staff survey, about how many people are accessing it and engaging in it, and where are those groups of people. So it means that there's an opportunity to explore what else, or more importantly, who else can help us gain the real insights we need to understand the culture of the organisation and the teams that we support. So there's no surprises when we link this all back to CQC Well Led, and we thought a pug on a chair would just absolutely cheer everybody up this morning, but there's no surprises, are there? So it is very much a case of really thinking about what have we got already, or where are our other opportunities, because that is only going to help you kind of meet the requirements of CQC when that happens.
Yeah, and let's take a couple of examples in a bit more detail. So, for example, let's say you've got a culture where you want to reinforce positive well-being. You send out lots of internal comms with tips on how to stay well. You might run specific sessions on health or the menopause. You might have wobble rooms, well-being rooms, fruit stalls, lots of different things. And you're really focused on promoting positive well-being, which is fantastic. But as an antagonist to this, you might have an absence policy that might be a little bit outdated, might mean, for example, at 4 absences, a member of staff gets a sternly worded letter inviting them to a formal meeting to discuss their absence. And then all the unwritten expectation is for them to justify why you've been off 4 times in the past 12 months. And it almost conflicts with the positive stuff that's trying to happen. And we can clearly see how these two things are in conflict. It's almost, how can we have that true enabling sense of well-being when we say one thing but actually do another. And another example actually is thinking about any policy that you've got. Does it mirror what we're telling people as well? It's coming back to that analogy of the unwritten rules. A few years ago, to give you, and you'll have seen this is something that many companies are introducing, but Netflix gave its staff unlimited holidays a few years ago. And it sounds like an absolute dream, right? You know, you can take holidays when you want, absolutely fantastic. But in reality, they found that even with unlimited holidays, staff actually took less than they did when they had a fixed limit. And there's lots of research around this. And when Netflix had a look at this and looked at the data and thought, well, okay, so what, you know, the data's telling us that staff aren't taking as many holidays. So what's the insight around that? How do we find that out? Speaking to people, they found, for example, somebody called Donna, who was a marketing manager who worked long days, and at one stage hadn't taken a true holiday in 4 years. And the problem was her boss and her teammates were all workaholics. So she was afraid to take a holiday because she didn't want to appear like she wasn't pulling a weight. And when that choice is fully the staff members, is that greater pressure than when an organisation actually says, right, you've got 30 days holiday a year to everybody. You can see here that individual team culture, almost the unwritten rules around, well, you know, you can't take a holiday, we've all got to work really hard here, supersedes the policy. It's really interesting, the kind of link between policy and culture. And actually, the policy can inhibit a culture change, and equally, a culture change can inhibit well-meaning policies as well. So where culture overpowers policy, we can explore this by looking at what's actually happening. And the reality is that we typically sense when this happens, we don't see the difference that we want or what the policy is intended. So there tends to be that friction at every stage. So you can explore that gap between what the policy says and what's actually happening. And the same is true if the policy is inhibiting the culture change that we want to see, but we can be really vigorous around this and explore a wider range of aspects. So the 6 steps that you can take, and if you take, let's stick with the theme of well-being, for example. So there are so many policies that might link through to this. So think about, you've got absence policies, you've got flexible working, disciplinary policies, lots of things could link into that topic of well-being. And it's important to explore all of them. So you might understand what that impact is, whether it's direct or indirect, because the culture is obviously defined by the way we do things around here, not necessarily what's written down. So taking the example of an absence policy and a desired culture that supports well-being, firstly, you could assess what's the absence policy's why. Is it to lambast people for being off at one end of the spectrum, or is it holistically to support an employee where they can and want to be supported to help staff help themselves? The second thing you can do is it working? And what's our gut instinct? What do we think we know within our HR and OD teams about the data that we've got? So, what's our gut instinct telling us? Is that policy working? The third step is going, well, are we sure? Let's think about what the measurements are telling us. So if our culture is meant to support raising issues of concern, for example, how many people are using our whistleblowing policy? If it's low, is that because there aren't any whistleblowing issues, or is it because people feel unable to use it, like we said before? Number 4 is around that wider data. So what's that wider data telling us? What are people saying? And again, thinking about the absence policy, you could ask people who've recently been through it, what it's been like going through the absence process. You might have some wellbeing champions, for example, that could review it for you, and there might be a bit more psychological safety there. You might decide to run through some scenarios that seek to challenge the policy fit, which you could do as a group of HR professionals, for example. And equally, you might think about how we could use a 7S model. So if you came to one of our last sessions, you'd be familiar with this. But the 7S model is a great tool, actually, when you're thinking about any kind of culture or organisational change. And again, if you're thinking about absence policy, for example, or absence metrics, how do you link that to each of those those S's, really? So skills, for example, to use the policy by managers to have absence conversations, is that happening? Strategy, what's your overall strategy saying? How does that link to the people plan, for example? What systems have you got that support absence? Is, what your reporting system's like, what are your support systems like, what's your Occy health referral system like? Structure, are the right structures in place to support the appeals process, for example? And shared values. So what are people's views on positive wellbeing approaches? How do they feel about actually taking responsibility for their own health and wellbeing? Is that something that they're up for, or not? What does that actually look like? And then the final step, step 6, if we make changes to the policy or the way that it's rolled out, how will we know that it's works and it aligns to our desired or actual culture? How do we know what measurements do we need and what insights can we gain? And it'd be brilliant actually if anybody is working on something like this. How do you test things? What measurements do you need to test that a policy has worked well, or a new initiative, or some kind of culture change? How do you test that? How do you know it's worked well? If anyone's here from the Northwest, there is a group of HR directors in the Northwest that were looking at the absence policy and taking a lot more of a holistic approach to well-being. And it wasn't, you know what it's like. It's not just about, oh, well, let's come up with a new policy. It's thinking about what is the impact of that? How do we make sure our managers know how to have these different conversations if it's taking a completely different focus? If we're taking triggers out of the policy, what impact is that going to have? But also then, how are we going to measure that? Because there's probably some short-term measures you could see, but how are we measuring it over the longer term? So are people taking less days off? Is that a good measure? Or actually, because people are taking more responsibility for the health, they're actually taking more time off, you know? So it's understanding what your measures are, and actually and you need to do that at the start to almost go, if you think that's that first session, what's our culture like now? What's the gap? Where do we want to get to? And how do we put some really key measures in place that are going to tell us what we need?
Yeah. And I think the most crucial component, we've mentioned it a couple of times throughout this webinar, is psychological safety. And I'm just curious, if you could just pop in the chat, if you put your Sherlock heads on for a second, like what clues are in all the different types of data and information available to you? What clues are there that tells you whether the psychological safety level is high or low? Just be really interesting to hear your thoughts. Please do pop in the chat. What would tell you that you've got high or low levels? So high levels of engagement, absolutely, people feeling like they want to speak up. So staff survey, how many people have completed that, and then also what the sort of things they're saying. Yeah, grievances always tell a story. Speaking up, we've all got the Speak Up Guardians kind of in our organisations now. How effective is that working? How engaged are people with that kind of process and that policy? And you know, even if we call, this is for another session, but we call be thinking about your pirates within your organisation as well. Pirates are people who are negative but have lots to say about it. Actually, that's a really good indication that there's a high level of psychological safety, because they are telling you what's wrong. So actually, it could be really, you know, don't be afraid of engaging with those people. So psychological safety is so critically important when we're talking about data, because if we are to look further than the quantitative data and truly get a picture of our culture, we need people to be open with us. We need people to feel like they've got the freedom to speak up without fear of judgment or repercussion. So I think last time we mentioned an example with an NHS organisation we were working with, who their theatres team, a group of staff had come together from the theatres team and complained to the person who was responsible for quality improvement, who sat outside of the team. So the complaints were raised, and HR and OD teamed up, went in as business partners to try and sort out what those people were so unhappy about. So it's great that those people spoke up, but fundamentally, if the psychological safety was there within that theatres team, those people would have spoken up to the management team within that department. And this is where the unwritten rules kind of govern how our culture is kind of set up. So it was a case of when the HR and OD professionals went in to speak to the managers and said, you know, these things have been raised. We want to do a piece of work that will just help us explore what's working well, what could be better. The managers said, right, well, what we're going to do is we're going to sit ourselves in the staff room, in the mess room, and we're going to just let people come to us and tell us what's wrong. So then it's kind of that nuance of, well, if the psychological safety is not there, how are they going to feel that and they've not come to you before with any of these problems? What's changed? We can't take that approach, even though it's a really admirable thing to do. We have to appreciate that psychological safety isn't there. So that's, and there's an unwritten rule within that team that you can't raise problems to the managers, even though that was all written down in those policies. And that's why we've got to explore, we've got to find the gaps in our data. And if you think about, you know, just statistically speaking, what's going on with psychological safety, a survey of NHS staff by the British Medical Association found that 25% of respondents felt too intimidated to raise concerns about patient safety or care, which is really worrying, isn't it? And then a survey about the staff survey found that only 66% of NHS staff felt they could raise concerns. So a little bit high, you know, that's higher, but certainly not enough. And that's obviously raising concerns about unsafe clinical practice and other statistics that exist out there as well. So there was a study published in the Journal of Interprofessional Care, found that healthcare professionals who perceived a higher level of psychological safety in their workplace reported better teamwork and communication, as well as higher job satisfaction. No surprises there. We all know this. We all know that that equals all of those things, but still we're not using our data and our insight to really tackle it. There was also a report by NHS Improvement, found that 30% of NHS staff had experienced bullying, harassment or abuse from colleagues in the last 12 months, which again can negatively impact psychological safety. And then finally, just thinking about the King's Fund, who you're probably familiar with, found that staff who reported a lack of psychological safety were more likely to experience stress, burnout and low job satisfaction. So there's lots of things that we can learn from there. I mean, not just in the NHS either. So you might be familiar with Amy Edmondson, who does a lot around psychological safety. And she's a Harvard Business School professor. Definitely sort of across the world, hospitals with a higher level of psychological safety have fewer medical errors. Even Google found that teams with high psychological safety had better communication, more effective decision-making, and were more likely to achieve their goals. So actually, there is so much overwhelming data around psychological safety that if we only focus on increasing those levels through our quantitative and our qualitative data, then we're going to be absolutely heading in the right direction. So it can be so easy, it can be so easy to focus on what goes wrong. We are programmed to do this, aren't we, as humans? And when we focus on what goes wrong when psychological safety isn't there, so for example, in the same way we look at never events, but obviously at Delve, we're strong believers in focusing on strengths and how we improve and adapt to create change for the better. So almost like looking at what are our always events instead? What can we get right to set our cultures up for success, to achieve the patient outcomes and the care that we need? So there's a great model within Amy Edmondson's The Fearless Organisation, if you have read that it says that psychological safety is made from these three core elements. So you can see on the screen there, we've got individual safety, team respect and team learning. So when we look at individual safety, these are the things that we can focus on that help us fill the gaps with our quantitative data. So thinking about individual safety, do leaders hear an echo chamber? So actually, you know, are we role modeling? Is everybody kind of on the same page with that? Are staff taking initiative? Are people owning their mistakes without receiving retaliation or criticism? We all know from the horror stories we've heard in the media around where some trusts have just, you know, horrible things that have happened, definitely linked to psychological safety and people not feeling like they can speak up when they're seeing bad practice or malpractice even. Are people asking for help? Are people asking, raising new ideas? And is there a policy or a system, going back to that 7S model, where are your processes and where are your systems that enable those ideas to filter upwards from the ground floor? So these are all the things we need to really think about with individual safety. And then moving over to team respect and what that actually looks like, it is all about feedback flowing. Is it flowing upwards, downwards, sideways? How is it received? How are people's differences embraced? Are all of our policies as inclusive as they should be? And where are the gaps? So going back to the Boston and the Hackney examples, is there something we're doing that is just missing the same people every time? What else can we do? And most importantly, building those relationships. Do team members know each other past the lanyard? Always think, have we got, you know, if you're doing any kind of team building, make space for people to get to know each other as humans rather than just focusing on work outputs. And are people's strengths recognised and utilised? If you've got an archaic appraisal system still and it's kind of focusing on the gaps, then definitely start looking at that, because we want people to be able to play to their strengths. And then finally, thinking about team learning, and it's all around what level, can people talk about mistakes? Do they understand that they can learn from those mistakes? Are they finding time to, new ways to improve processes, for example? So Costco, actually, we've all been in Costco, haven't we? I go for a free lunch when they do the samples, but actually when we think about Costco, they allow an hour a day for every single employee to walk around the store looking for things that could be improved. And we don't make time for that within the NHS, do we? We're all so busy on the hamster wheel that very few people get the time to just sit back and think, is this the best way of doing something? Are there any new ways we could try that might make things better for patients or ourselves? So take Costco's example and think, am I allowing people to have that time to really think creatively? And then again, are we seeing those concerns being raised about team plans or decisions? Is team time protected? It's usually the thing that gets cancelled where we're building those relationships with people. And our meetings, how effective are they? Are they all just a round robin of what everybody's up to? Or are we actually thinking creatively as a team? So and again, I'm sure as people professionals, none of this is a surprise, but we just wanted to give you some focus where you can kind of get your blinkers on and have a look at these three things.
Yeah, and I think as well, when it comes to psychological safety, there is that E that's often missed, which is around evaluation. But just to give you a bit of an example before I talk about that a little bit more, in a previous NHS organisation that I worked for, one of my team members had a disability and was a wheelchair user, and he gave some feedback. Actually, there was a disabilities network, a group of champions, and he gave some feedback that actually in the toilets the bins were pedal bins, and he couldn't open the bin after he dried his hands to put the paper towel in the bin. So I thought, well, that's actually really constructive feedback. Surely that's a bit of a quick win that we can do something about. But actually it was a real struggle, and it didn't change for over a year. And I know obviously there's lots of processes and things that we need to get through, procurement, that kind of thing. But for that person that almost lost that trust and that psychological safety, because he'd felt comfortable enough to raise a concern, but then didn't see anything happen about that. So when people asked him for his thoughts in the future, he shut down and, well, what's the point? Because actually you're not going to do anything about it. So why should I speak up? So that psychological safety is so, so important. And when we're thinking about evaluation, obviously by understanding any diagnostics and letting our data give us those real insights, we can start to understand which measures are actually going to show whether cultural transformation is happening over time. So we talked about this when we talked about policy change, but if you're also thinking about some of those unwritten rules and the importance of psychological safety, how can you measure or see that that's actually changing for the better? And I know some people have popped things in the chat like psychological safety audits, for example, and some of those key measures. But just to give you another example, if you're exploring your values and how they are actually lived in the organisation, how do people evaluate success? Please feel free to pop in the chat. How do you know your values are working? And while you're popping ideas in the chat, just to share an example again, an organisation that I work for, I think we had about 6 values at the time, which is probably too many in hindsight, but there was one around teamwork, there was one around accountability, for example, there was one around respect, and we had a scheme in place where you could nominate a colleague for going the extra mile, and you had to talk about in that nomination which of those values they demonstrated. Now, this was really useful data, because the kind of the requests and the nominations came through the OD team. So we could start to build up a bit of a picture about which values are the ones that people are most being recognised for. And we found that there were loads for teamwork, loads for respect, loads for some of the others that we had there. But actually, one of the ones that we weren't seeing anyone get nominated for was accountability. So this was really interesting, and that was some data, so not necessarily a lot of intelligence or insight there, but some data that suggested people were maybe struggling to connect to that value, Was it that people weren't being accountable, or was that one of the values that actually, you know, it was harder to demonstrate? Was it even a value that people felt was real anymore, because it'd been a while since we'd even explored or revisited those values? So it just gave us some really useful data to then start to think about what further analytics do we need to do to find out more about this. Is accountability a good value? What does that mean to people? So we were able to go out, do some listening events, ask people not just about accountability, but all the values, to go, you know, what does accountability mean to you? And it means very different things to different people. Like, when you see that demonstrated, what does that look like? And that was a really useful exercise to help us shape the future values and start to refresh them, because we were getting that insight. So that's just an example. We've got a couple of things in there around lower numbers of grievances, complaints, etc. So it's understanding really getting those measures right from the start, and thinking, as I said before, you know, some measures that you think might be good actually might tell a different story. So we want to see absence reduce, but actually if people are feeling more positive to take ownership for the health, in the short term, you might see that go up a little bit, because people aren't just coming to work when they're ill, they're actually taking the time off that they need. But you might find that actually those absences are shorter and not longer. So it's understanding what the data is, but also thinking about what do I want that data to measure? What is it going to tell me? Have I got the right measures in place? Because actually sometimes you think you have, but they're not. They tell you a different story. And why is that? So by understanding the impact and demonstrating that return on investment, you can unlock that greater credibility. If you're needing to influence senior leaders, for example, with a business case around a culture-driven initiative, if you've got that clear return on investment, it isn't easy to do, but if you can demonstrate that and think about what you need to demonstrate from the beginning, it can really help shape that. So that that's often, and we're all too busy as well, aren't we? You know, you bring initiative in, might be a little bit of evaluation, but then we're on to the next thing. So it does take time to do it properly. But when you think about, just coming back to, we said this earlier, because we're coming towards the end now, and it'd be brilliant for you to start to think about what action you might take away from this. If it's just one nugget that you might have found, it'd be brilliant to hear that. But think about, what data do you get in your organisations? And we've shared lots of things on the slides. There's lots of things in the chat as well. Is there anything that actually you've thought of that you've realised through this session that you thought, oh, actually, I didn't think of that as being data? What's that? Where is that gap for you to get that real insight? And just have a think about, if you can type on the chat perhaps just one thing that you might do differently, or something that you're going to explore. So thinking about that culture that you want, you might know where there's an issue. You might have just got some really great insights from the staff survey, for example, but what are you going to do next to get some real usable insights from that data that you've gathered? So if anyone wants to just type one thing on the chat, that would be brilliant. And just to summarize really in terms of while you're doing that, what we've covered today. So today was very much around thinking about data and how we turn that data into insights, but also what are those unwritten rules that are shaping your culture, and how can you use data to do something about it? We focused on what's the difference between data and intelligence and insight. We've thought about what are the different types of data, and who might be getting on board at different stages with that. And we've also explored a little bit around examples around the absence and wellbeing example, the influence that policy and culture can have on one another as well, and some steps to think about that. And then finally, we've touched on psychological safety as a key unwritten rule almost, and thinking about that evaluation process. So that's everything that we've sort of covered, but it'd be brilliant just to hear from you. And I think there's a few things coming through on the chat there.
Yeah, loads coming through. And I think a lot of it's about, Khalida, like you said, about educating people, giving people time to work with data is a big starters for 10, isn't it? Let's just have a look what else we've got. Yeah, again, for Lisa, spending more time analysing that data. Get stories out of your data. Think about how that might apply to a real life person. And because when you can pin something around, we know how powerful storytelling is. When we can pin data around an actual story about somebody's experience, people share that much more rapidly than we ever share data with each other. So absolutely, if you pin it to storytelling, that is going to be really, really impactful.
Lots around making that jump from analytics to insights almost. So you spend a lot of time analysing it, but how do you kind of get the solutions for the insights as well.
Yeah,
the policies, sorry, I was just going to say.
I'm just going to say the same.
Yeah,
that's a really good one. Yeah, absolutely, because we see that all the time, don't we? We kind of go, well, and this is where the unwritten rules come in. What's the actual practice? What's written down, and what are people doing? And if you just keep those two questions in mind, you'll start to get real insight into what actually is the culture within the organisation. And you don't need data experts. There's people doing that all for you, Khalida. Absolutely, it's there. Just talk about it, understand it, turn it into stories. It's going to really bring that data to life.
I'm glad the stay interviews, I love that as well. So thanks for sharing that idea in the chat, because I think that's sparked with a few people around, oh, how can we do that slightly differently to exit interviews? So that's brilliant.
Yeah, it's not too late then, is it? It's like capturing before they go. Fantastic. Yeah, and observations are just, quite often we're quite driven by quantitative data, because that's what we have in abundance, but don't underestimate the power of just looking, observing, watching, listening to anecdotes, because we might not think that's as valuable as insight and data, but actually sometimes it's worth more. So it's really just fill the gaps with those things. If you tend to be focused on the qualitative stuff, the quantitative stuff, I keep getting those two mixed up, apologies, but then really get that balance right by just hearing stories and hearing what people's experiences are.
Yeah, brilliant. There's some really good points in there. So have a look and see if there's anything else that you can pick on that would be really useful. Schwartz rounds, yeah, brilliant example of sharing stories, actually, when I've seen that work in practice. And the feedback, absolutely, Terry, because that was the key thing. It's almost, well, I've contributed to this survey or I've done it, but actually, if I'm not seeing the results, what's the point? And that can have the biggest impact on psychological safety. Fantastic.
Absolutely.
So, so we'd love to hear how you get on. So do feel free to get in touch with us and let us know. Our details are just on the screen there. And if you come into our next webinar, I think it's on the 30th, it'd be brilliant to see you there, and feel free to share that as well with others. Just a question on the chat there. This might be one for Joe and Tracy. On the waiting list for other webinars?
Okay.
Yeah, I'd seen that one. Joe, can you help us out with the details of exactly where on the internet and on our website the webinar will be posted at a later stage? Joe, are you there?
Oh, she's put in the chat that it's going to. Yeah, it's going to be on the hub.
I was just trying to take myself off mute. Yes, certainly. If you go to the HPMA website, which is www.hpma.org.uk, and if you go to on the menu, if you go to membership, scroll down to the bottom, and there's the HPMA hub there. You can just register yourself, and then it'll let you straight to the system. And there's about 140 webinars to look at that we've saved over, well, probably since the beginning of COVID, I think we started this. So there's a lot of information and data on there and handouts and things. So it's a really good place to go to see. If you're looking for something, that's a good place to go and start to see what's there. This will be added in the next couple of days. So just give us a little time and we'll get that uploaded for you all to view again.
Great, thanks, Joe. Okay, well, I think it's an absolutely great opportunity to once again say a huge thank you to Caris, to Sarah, and to Nick for another riveting hour. They go so quickly, these, don't they? And you share so much with us, which is it's immense value. So thank you. And to colleagues that have been putting things in the chat as well, it keeps it very interactive, and it's great to share those ideas and what we're doing well, but similarly what we're also looking for some support and some help on as well, which is what this is all about. I think some of the questions that we've had is all around psychological safety, and I guess that does lead us nicely into next week, doesn't it, on the 30th, because the next one is about how are we going to increase the levels, and we'll, I'm guessing you're going to talk to us about how we're going to do that one conversation at a time.
Absolutely.
So we will really look forward to that. And if you are able to join us next week, then we really look forward to seeing you. And if you're unable to do that next week, then as Joe said, similar to what we'll do with today's session, a few days later we'll post the recording on the website, so that will be great. So finally, just to say then, Sarah and Nick and colleagues from Delve are shortlisted for an award. ceremony at lunchtime today. So I'm sure everybody on this call will be sending you with huge good luck, fingers crossed, toes crossed, eyes crossed, everything crossed for success. We hope you do well, guys. All right, because
Thank you so
Thank you.
much.
we really enjoy working with you.
Aw.
So